Hi, everyone. Welcome back to another episode of Beyond the Script. Today, we have Dr. Mark Kirchhof. He is the Division Head of Dermatology in the Faculty of Medicine at the University of Ottawa and the Ottawa Hospital, as well as the President of the Canadian Dermatology Association. He's here with us today. Thank you so much for coming.
Oh, it's a pleasure. Thank you for having me.
Absolutely. So first, I'd like to know, why did you choose dermatology?
Oh, this goes back. Okay, so this is, I'll give you a shortened version of this.
Sure.
I actually was not interested in dermatology until very late in my medical career. So most people who decide on dermatology usually decide very early on because it's a very competitive specialty.
Oh.
But I was interested in everything. So I actually started with an interest in surgery, and then I was interested in internal medicine, allergy immunology for a while. I have a PhD in immunology, that's why, and then rheumatology. But then I eventually settled on dermatology because I think the variety is tremendous. It's one of the specialties that has the most diagnoses, so you really never know what's going to walk in the door. Yeah. It's always exciting, always interesting. I also like the idea that it provided you with a certain amount of freedom. Some other specialties, you're sort of beholden to the hospital or beholden to some other, funding source that is able to determine what you can do and how much medicine you can practice. And so I looked at that and said, well, I don't mind that in some circumstances, but sometimes maybe I want to be more independent. And dermatology allows you to work in the hospital, do inpatient care, also to be an outpatient provider, and then to have your own clinic. And so that variety was very attractive to me. And then you also get to see pediatric patients and adult patients. Yeah. So it's really the best of all worlds. A little bit of surgery, medicine, a lot of immunology, cancer diagnosis, cancer treatment. There's a whole cosmetic process that I don't get involved with, but that's certainly there. But I really like the variety and the different things that you see. Yeah.
Yeah. You mentioned you kind of never know what will walk through your door.
That's right. Yeah.
Can you give me a range of what you might see and something else that's entirely different?
Okay, sure. Let's go through some things. So we can see things from, infestations of worms that people have picked up when they're on a beach vacation down south.
Okay. I did not expect that answer at all.
To a potentially deadly blistering condition where your immune system is attacking your skin. To
deadly blister.
Yeah.
I didn't know that was possible.
There you go. And then there's an indolent form of cancer that can only be found inside your skin.
Wow.
And then, of course, we see acne, rosacea, and all the common things that people are used to. But yeah, it's a wide variety.
Wow, that is terrible. Okay, I didn't know. I got to be on the lookout for wearing new shoes and getting a blister.
I guess. Be careful going south and barefoot walking on beaches. Yeah.
Wow. So, what do you think is a skincare trend that people should stop doing immediately? Is there something that comes to mind?
Oh wow, I don't know where to start on that one. There's so many things. I mean, for a while there was this idea of perineal sun tanning, and so there was a trend it still continues, where people think that exposing this area to sun is actually a good thing. Yes.
Oh my gosh.
Yeah.
Okay.
We're also seeing now, and related to that is people that tan are putting little stickers on and little designs. We've seen that as well in social media take off recently.
Stickers?
Yes, or designs or things like that to make a pattern on their skin with the tan, right?
Oh, I see. So they put that on while they sit in the sun or something.
Yeah.
I know people do spray tan and tanning mousse. Is that less harmful? I assume that's less harmful than sitting in a tanning bed or
Yeah, absolutely.
Okay.
Yeah, tanning beds and getting a tan from the sun is basically an indication that you're damaging your skin. That's why you're turning brown.
Right. Yes.
Tanning mousse and tanning spray is, you can think of it as a form of a dye that you're putting on your skin. It gives you the color.
Okay, got it. Wow, that's interesting. Oh my gosh, wow. I feel like that's a lot of, especially women would probably want to know that if you want to tan, use tanning mousse or lotion. Yes. Don't sit in the sun or tanning bed or anything like that.
Yes.
Wow. What would you say is your most controversial skincare opinion?
Oh boy. I also have many.
Okay. You can say as many as you want.
Wow. Well, I've actually done another podcast with a colleague of mine in Halifax, and we went through some myths that are currently floating around and things that are happening. So one of the big trends right now is the idea of peptides. So you'll see peptides, which is sort of a generic term used for everything, and it solves all problems. And so a lot of cosmeceuticals or products you'll hear about over the counter, people will talk about how peptides in these products are going to solve any problem that you have.
Okay.
And some of the peptides have some data behind them, but most of them don't. And so it's one of those cases, usually where people take a small idea and then expand it beyond where it really belongs. I think that's one thing. Another trend that we saw recently that was promoted in a lot of social media and by a lot of companies is this idea that you need full body deodorant.
Oh,
Yeah.
I haven't heard of that.
Okay, well, there
Really?
you go. Breaking news here.
Yeah, you tell me more about that?
Well, the concept is that if you apply deodorant to certain areas, why shouldn't you apply it to all your areas?
To prevent sweating everywhere.
Yeah, sweating and odor development.
Okay, I never thought of that.
Yes. I don't think that's a good idea for
No.
a variety of reasons,
Yeah.
but yes, that's another trend that we've seen come up.
Wow.
So dermatology is very interesting for this fact too.
Yeah.
It's sort of the intersection between medicine and consumerism
Yeah,
and
definitely.
public products. So it's a
Wow.
fascinating topic.
Probably dermatology, I would assume, of all specialties is one that's the most integrated in consumerism, and you have to deal with people coming in and saying like, oh, I tried this new product that I saw online and
Yes.
it destroyed my skin or something, and then you kind of have to deal with it.
Absolutely. Our conferences now really also dissect those two areas. We'll have people that are talking about new drugs development and how it will cure a disease or help a disease next to a booth that's talking about, the best shampoo that you could use.
Wow.
And so that's fascinating sometimes.
Back to the deodorant thing.
Yes.
Could you quickly explain why it's a bad idea to put deodorant everywhere?
Well, there's the concept is based on that human beings produce sweat and that everywhere is potentially a source of smell and therefore you have to stop sweating and deodorize all of it. So the first thing is that we have to understand what a deodorant is. A deodorant is different than an antiperspirant.
Okay.
So there's two different components there. So deodorant basically masks smell, kills bacteria. And so you're often applying some sort of a perfumed fragrance product, sometimes some alcohol or some sort of a product that will reduce the bacterial colonization, so to produce the odor production from those bacteria. And so you can imagine if you're applying that to large portions of your skin, it can be, destroy good bacteria because we have good bacteria. And then a lot of people can develop allergic reactions if you're putting like perfume products everywhere.
Yeah.
And the fact is that most people don't need it. If you take a bath or a shower on a regular basis, that's probably fine. You don't need to invest lots of money in the product like this. So that's unnecessary. Antiperspirants are ones that block sweat entirely. And sometimes sweating is important, right?
Yep.
Yeah. And so when you're exercising or when you need to cool yourself down, sweating production is a normal part of our everyday metabolism. So we don't want to necessarily block everything. This idea that everything that our body does is bad, I think, is a concept that we should not endorse.
Yeah, absolutely. Would you say that's maybe something like the skincare industry kind of tries to tell people, that there are things that you need to stop about your body but are actually quite normal and natural?
I mean, there's lots of examples in other industries too. For a while there, dentists and a lot of dental products came up with the concept that your teeth need to be shiny white like this table.
Right.
And if they're not this white, then there's something wrong with you. When we know that there's lots of different shades and nobody's perfect, nobody has this perfect white color unless you have fake teeth.
Right.
And so this concept of you need to achieve perfection, and if your body doesn't achieve this level of perfection, then there's always something lacking, I think is a problem. And especially in dermatology, because we know that nobody has perfect skin. I'm going to put that out there right now. Yeah. Nobody has perfect skin. So and that's normal, and that's fine. We are all flawed in different ways, and we have to be accepting of those things.
Yeah. And there's no such thing as perfect in
Exactly.
any way.
Exactly.
Yeah. I'd like to talk more about skincare steps.
Sure.
Do we really need 10-step routines like we see online?
I'm going to preface this two things. So you're talking to somebody who is very particular about the science that I believe in.
Okay.
I have a PhD. I have a scientific background. I did a molecular biology undergrad. So I am very strict on what I recommend and for the reasons. And so with that, there's going to be lots of people and a lot of other dermatologists who will recommend a whole line of products.
Okay.
And so I believe in keeping things extraordinarily simple. And so what do I believe in? And this is what I tell patients. So the first thing is a moisturizer. because we live in Canada and we have dry winters, we have central air, and certainly our skin can lose moisture from that. We also live in a damaging environment. You can have damage from the sun, damage from wind. Maybe you're working in an environment that's dusty and there's lots of chemicals. So moisturizers are good for protecting the skin. So that's number one. The second thing is a sunscreen. We know that sun and UV radiation can cause damage to your DNA and can cause potentially skin cancer. And so using a sunscreen is important. And we also know that the sun can cause photo damage and photo aging. So you actually can look older if you get lots of sun. So a lot of people don't want to look older.
Yep.
So wearing a sunscreen is important. So moisturizer, sunscreen. And then the last thing is if you really are concerned about aging of the skin is something that contains a retinol or a retinoid type product. These have very strong evidence to support that they can reverse some of the damage and renew the skin and actually thicken the skin. So that's the one big thing. Now you're going to hear about lots of other products out there. You know, there's toners, exfoliants, there's serums, there's certain vitamins that people put on their skin. The data is all, I will say, not as strong and doesn't meet my level of recommendation to most patients.
Fair enough. I didn't know that there was something. I've heard of retinol, but I didn't know that it had kind of reversing effects. So I guess that's good to know for people. If it might not be too late to do some controlled, some damage control, I guess. But if you, fair enough.
Sunscreen is the most important thing.
Yes.
The vast majority of aging comes from sun damage, and so if you protect yourself from the sun, that's the most important thing.
The vast majority.
The vast majority. So if you're going to invest in anything, good sunscreen.
Sunscreen. Is there a difference between SPF 30, SPF 50, SPF 50, or is there a number that eventually doesn't really make a difference if you get high enough, or?
It's so the higher the number, the more protection you're going to get.
Yeah.
The actual percentage of radiation that you're blocking as an overall percentage diminishes as you increase that number. So in other words, going from an SPF 1 to an SPF 5 is a lot of sun protection. From something like a 50 to a 65 or 75 or 100, the actual absolute percentage is less. But what we do know is that most people are not applying sunscreen correctly.
Okay.
So we're often underutilizing sunscreen, and they've done studies correctly. So
can you explain what are people doing wrong?
They're usually not applying enough. Sunscreens. Most people don't like putting sunscreens on their skin. Variety of reasons. You know, some of them are sticky, some of them are thick, some of them give you that white appearance. And so often people are underutilizing the amount of sunscreen that's required to give you the protection factor that says on the bottle. So for that reason, we say use a high number because the likelihood is that you're going to get at the end probably a lower number.
That makes sense. Yeah. And also if people are like outside playing all the time, they might not want to stop to reapply. They want to just be able to, if they're going to put it on, they might put it on at the beginning, or if they're out for several hours, they might not really care to stop and reapply.
Absolutely. And that's another thing that there's been some interesting data on. You know, there's a whole thing every 2 hours you need to apply sunscreen. I would say you only really need to do that is if it's coming off. So if you're sweating and exercising or you're swimming, absolutely, reapplication is important. But if you're just, going about your regular business, I have some patients who become so obsessed, they're like every 2 hours their alarm goes off, and they're like, I got to put sunscreen on. And we never want to create that kind of pathology or concern that level. It's, if obviously it's coming off, you're doing something where you're sweating or exercising, then yes, you should reapply. But if you're just going about your day, then probably one application a day is enough.
You touched on this a little bit before. Can you explain actually what sun damage does to our skin? You said that both it does, speed up aging, and also why and how does it actually cause skin cancer?
Oh, sure. Okay.
Because I feel like people need to know why sunscreen is so important.
Absolutely. Okay. So
we always hear it, but we don't know why.
The one of the mechanisms by which we get skin cancer is by damaging our DNA. Okay. So in all of our cells, we have DNA, and we know that there's these two strands. And if you get damage to it, and there can be a variety of different ways to get damage. So solar radiation is one way. The DNA can actually break, or the base pairs can change. So basically the way it's coded can be a problem. And you can imagine the more times you damage your DNA, that maybe at one point in time you're going to hit a very important gene that is important for regulating how fast the cells are developing or dividing, right? And when that happens, then you can start the process of getting a precancerous cell, and then that changes into a cancerous cell depending on how much damage accumulates. So it's the UV radiation that actually damages the DNA and causes a break or a change to some of the base pairs.
Okay. And can that happen like over time? Like if someone is spending every summer, they're outside all the time getting sunburned, will you see the effects not until a little bit later in life? Or?
Absolutely.
Okay, so it's good to be mindful of it now.
Yes, the skin never forgets.
Yeah.
It is like a historical recollection of your life in some ways. And so what happened to you when you were younger certainly can manifest later on when you're older. And we see that. I have lots of patients who grew up on a farm, never wore sunscreen, never wore a shirt, and then they may have had their entire life lived in an office and never went outside. But because they had so much sun damage early on, it manifests later on and they start getting lots of skin cancers.
And they won't see it until later, probably.
Yeah.
Oh, that's interesting.
Yeah.
Okay. What about, is it important that we wear sunscreen even if we're not going outside, even if it's a cloudy day? Does that matter, or is it purely just for sun?
Well, even a cloudy day, you're still having radiation come through.
Right.
So ideally, yes, sunscreen every day. That prevents, just because you don't have the strong sunlight coming through, you still have some sunlight coming through, some radiation that can come through.
Okay.
Yeah.
So even indoors, if
Yeah. We don't know. Some glass is very UV protectant,
right?
But some is not. So that's the important thing to know. And then even some may be protective to certain bandwidths or certain components of UV radiation. Sometimes they don't have the complete protection throughout all the different wavelengths.
I've seen some photos I've seen online of truck drivers, people who are truck drivers for decades, and they have one side of their face that's, you can see the difference, and after years and years of no sunscreen, because the window on whichever side they're driving on the side of the truck, the window has been left side. The sun has been coming in. The sun has been coming in for years, and they don't wear sun protection. So I guess even that is just, even if you're driving, if you're in the car for a long, long time, something like that. Yeah.
Absolutely. And some of that is DNA damage. It's also potentially due to the damage to the actual structures of the skin.
Okay.
So our skin contains different layers, and the radiation can actually damage some of those structures, and then the repair mechanism sometimes is not as good as the original.
Okay.
So elastic is one of the important components of our skin, right? If you pinch your skin, it goes back down. If you look as people get older and you pinch the back of their skin, some of it will stick there for a long period of time. Okay. So that elastic rebound goes away with more and more sun damage.
So is that also an indicator of aging?
Yes.
If it's less elastic?
Yes.
Okay.
Less elastic, yeah.
Interesting. So as we approach the summer months, what would you want everyone to know about sun damage, sunscreen? I guess everything what we just talked about.
Yeah, I mean, that's, but I think I still say to all my patients, again, don't stay inside your entire life. Don't close the curtains. Don't experience life, because life is still short, and we have a certain amount of time when we're alive to enjoy the summers and winters that we have. In Canada, our summers are particularly short, so get out there and do enjoy what you can. Take protection and take precautions. And that's sort of the same thing, right? We get into our car, we put a seatbelt on. And same thing when you're going out in the summer months and there's sun, and even the winter months, because you might be out outside as well. Put on some sunscreen, take some precautions, protect yourself. Try to avoid the strongest sun of the day if you can.
Right.
That's always a good idea. Seek shade. Whenever I go to any kind of a, south vacation where I'm going to be swimming or being exposed to sun, I'll wear a sun shirt. So it's something that people can do.
Okay.
So if they don't like sunscreen, there's alternatives to that.
Okay. Yeah.
So there's lots of things you can do to protect yourself. But do enjoy life. That's the most important thing. Take precautions. Try to prevent damage as much as you can.
Yeah. I like what you said about, life is short. We're still trying to live and enjoy our lives.
That's right.
Protect yourself, of course. Yeah. But to an extent, don't block yourself from any sunlight just for the purposes of basically what you said. Be realistic, still go outside, still do fun things, just be smart.
Drive your car, get in your car, wear a seatbelt.
Yeah, exactly. Is there a difference between really expensive luxury sunscreen and just sunscreen at a drugstore, or just skin products in general? Is there a difference? And should we actually be buying these more expensive products?
The answer is by and large, probably not.
Okay.
We know that the ideas and concepts of luxury are often based on good marketing and brand name recognition.
Right.
And you probably can get the same effect and same efficacy from the cheaper products as well. Now, that's obviously sometimes going to be not necessarily always true, but in the vast majority of cases, right? And so, yeah, if you want to buy the no name, no brand sunscreen, sure, I think that's just as good as potentially buying the very fancy sunscreen that emanates from some European country,
right,
and has been endorsed by 3 or 4 celebrities.
Yes. So, and also, it might, if someone's going to buy sunscreen, it's better that they buy the cheaper sunscreen than none at all. If they look and think, oh, if I have to have the luxury, then I can't afford that, then I'm just not going to have anything at all. It's better to get the $20 one from Shoppers if that's what you can do.
Yeah, we can take the car analogy again, right? There's like very luxurious car brands out there, and there's car brands that are not, but both of them will get you to the same direction.
Yeah.
Yeah.
So I'd like to go to a topic that I would assume is generally what you see day to day, which is acne. I assume that's most common. I mean, when I hear dermatologist, I think that's someone who also has acne.
Yes, I know.
But that's probably...
That's a misconception, I'm going to say.
Okay, please.
Yeah. I know. We often... Dermatology is one of those specialties that does get maligned a lot in media. We keep track of all the times that we're mentioned in various medical programs. And that's okay. And often it's, it's pimple popper MD or it's, et cetera. So we understand that often people think we just treat acne. Certainly I do see a lot of acne, but it's not the majority of things I see.
Okay.
Most of acne is probably treated by family doctors and primary care providers.
Oh, okay.
We only see the acne that is usually very severe or that's not responding to, some topical therapies, and then they need stronger therapies. So the vast majority of things that I see probably are skin cancer and sun damage and precancerous lesions,
I didn't know that. I assumed that, at first I didn't know that acne usually is treated by a family doctor. I guess they have enough knowledge to be able to do that.
Yeah.
And then it's just more severe cases, like you said. It's not about getting referrals, because I know that is also it can be difficult to get a dermatologist referral.
Yes, there are not enough dermatologists in Canada. This is true. I wear a hat of the CDA president, and we just looked at the data. And so Canada has about 1.9 dermatologists per 100,000 people.
Okay.
The goal,
that is, I processed in my head after you said that.
So the goal would be to have a minimum of 3 dermatologists per 100,000. And if you look at a country like Germany, they have 7.7.
Wow.
So we're far below a lot of our other peers in the world in terms of dermatology care. And then you add into that the fact that we are a geographically massive country, right? And so you have a lower number to begin with, and then this massive land mass. So we are underserviced in dermatology. But I'm sure that's the case with a lot of medical specialties. But yeah, that's one of the reasons why there is long wait times potentially in certain areas. Not everywhere, obviously, but in certain areas,
Do you have a theory as to why that is? Why there are so few dermatologists in
Canada? So one thing is training spots.
Mm-hmm.
We trying to get more and more training spots. This past year, for instance, there was only 1 dermatology training spot for all of Atlantic Canada.
Wow.
So you think about that. 1 dermatologist for all those provinces in 1 year. So that's something that really we're trying to advocate for and to make sure that there are more training spots available. Certainly, there's a lot of people who want to go into dermatology. It's a very high demand specialty from the medical students' point of view. So, more training spots is certainly necessary. Recently, the government has also decided to open up the licensing for international graduates. So we have seen more international dermatologists coming into Canada and starting their practice, which is also a great addition. So, but certainly, we probably need between 400 and 500 dermatologists in the next 10 years on top of what we have right now.
Wow. I had no idea.
Yeah.
Wow. I went a little bit off topic with that, but I was originally wanting to talk about acne. But,
okay, all right.
What actually causes acne?
Oh, okay. Acne is like a multifactorial thing. There's not just one thing that causes acne. The vast majority of acne, we'll say, is driven by hormones bacteria, and inflammation.
Okay.
And so the oil that we produce on our skin, sebum, is regulated by hormones.
Okay.
So that's why you often won't see somebody who is, 6 or 7 years old who has very severe acne.
Yeah.
Yeah, right?
Because their hormones haven't
started to develop, haven't been expressed yet to the level that they stimulate the oil productions, and so hormonal changes occur usually as we were teenagers.
Yeah,
and
of course.
That's right.
That's
And then we see this ramping up of oil production in our skin. People will often describe it as oily or greasy skin, this sensation, and that serves as a food source for this bacteria. And the bacteria then consumes that, produces chemicals that can also be irritating to the skin. The bacteria also grow. That causes the body to say, oh, wait, this is bad. I should start an inflammatory process. So your immune system becomes activated, and that's why it becomes red. That's why it becomes painful. That's why pus, which is immune cells, come to that area. And then you can get things like, the acne bumps. You can get like a pustule, or you can get like a big abscess where there's nodules or abscesses under the skin. Yeah.
Wow.
A lot of people for dermatologic conditions tend to blame themselves for the reasons they have the condition. And I really try to steer away from that. You have a skin condition or a skin disease, and the contributions or what people do about it usually don't matter that much. It's unfortunate that it's the hormones that they have. It's the fact that they have genetic predisposition to this. Right. So if anything, you should blame your parents.
Okay, there you go. Everyone
don't blame yourself.
Your family.
Don't blame yourself. Blame your parents.
Okay.
Yeah, a lot of the things that we see are inherited.
And that must make it harder to treat, would it?
Well, no, we still have very good treatments for these things. Absolutely.
Yeah.
We can do very well with the topicals and the pills that we have to treat acne. That's not a problem. But I just want to step away from the idea that, if you do this step and this step and this step, somehow you can make acne go away completely.
Right. Yeah.
Because sometimes it's very severe and everything you do may not help at all. And that's why it's important to seek medical help.
I would imagine there are a lot of people who think, I'm doing all these things, like I'm doing what they say to do and wash your face and moisturize and things like that, but why is it still there? And I like what you said about it's a skin condition, it's a skin disease, and I feel like maybe can be validating for someone to hear, because acne is so normalized and it's just so, just lots of people have it. And to the point where I
still get acne, so there you go.
Yeah,
we all get
exactly.
we still get pimples. Exactly.
Yeah.
Dermatologist still gets acne. There you go.
Yeah.
That's a good title for a book.
That is a good one, isn't
Exactly,
it? Yeah, that's true.
Yeah.
But it really is a skin disease, and it's something, especially you might be genetically predisposed to it. It's just harder for some people to get rid of.
Yeah.
I know Accutane is a big medication, I guess, for people who have pretty severe acne. Is there a reason why that's usually kind of the last resort when it comes to helping, or is it not? Is it more easily prescribed than that?
I think it depends on a variety of factors. So one, patient comfort with how aggressive they want to be in their treatment. Some patients don't want to do pills or can't swallow pills or are worried about side effects of pills, so they will stay away from it. Some people have very mild acne and they probably don't need pills necessarily. And then it's also the comfort level of the doctor that they're seeing.
Okay.
So some doctors have different comfort levels with certain medications. And patients should realize this. If they're not getting, let's say they want, so Accutane is something called isotretinoin, because Accutane is actually the brand name.
Oh, okay.
Yeah.
Everyone
just calls it Accutane.
Okay.
Yeah, it's like Kleenex and tissue,
Oh,
right? Yeah,
okay.
It's sort of the same way we think of it that way.
Yeah.
So Accutane is a brand name. Isotretinoin is the drug, and we talked about retinoids for aging. It's in the same family.
Okay.
So it's a form of a vitamin A derivative. It's a pill. It does have side effects. It does often need some blood testing or blood monitoring. It can cause birth defects if somebody becomes pregnant when they're on isotretinoin. So we have to talk about that with our patients to make sure that they realize the consequences that potentially if they get pregnant. And it can cause changes to liver or fats in your blood.
Wow.
So there are consequences. But that being said, you can use it in various doses and various formats. and it can be very beneficial. And what I tell my patients, it's the only thing that really has the potential to cure acne.
Wow.
70% of people who go through a course of isotretinoin will have their acne cured, quote
Just
unquote.
Gone. It stops it, kind of.
Yeah.
But the reason, so that sounds pretty appealing.
Yes.
But the reason there might be some hesitancies because of I've heard it's a pretty strong drug to be on, and the side effects can be tough, which is why it seems like a big commitment.
Yes, can for some people, but
Yeah.
again, it's really the dose that makes. And there's been some recent studies to suggest that in the past, where people would prescribe very high doses of this medication to try to shorten the time period that people were on.
Oh, that would
And
make
so
side effects.
yeah, so you had lots of side effects,
Yeah.
but it was a short period of time. So a lot of historical context around that has developed. Now, a lot of dermatologists are practicing where they're giving low doses, less side effects, but for a longer period of time. So it's a gentler drug when it's given that way. It has less side effects. People tolerate it better. And so I try to avoid getting those crazy side effects in those patients if I can.
That makes sense.
Yeah.
I imagine maybe if someone's like, my wedding is in 6 months and I want to everything be cleared up, so they fast track it. But
Yes,
maybe and they're okay with the side effects, I guess.
Yes,
But
I have other
it's-
things I would do in that situation. But
Okay,
that's
fair enough. Fair enough.
Okay.
Can you explain why? I always hear that, like, sugar, dairy, maybe lack of sleep and stress can affect acne or just skin in general. Can you explain why?
The relationship between food and acne is one that's often been described. And the fact is, that link is not the strongest, I will say. There is some mild evidence around high sugar diets, high milk diets as potentially worsening acne. But for a long time, people, again, it was sort of this ingrained in historical context that if I eat greasy food, I'm going to have a greasy skin, which then makes my acne worse. And so that assumption that, what you eat in terms of grease causes the greasy skin, but as I just told you, that's not the case. It's hormonal changes and things that, the oil production from our skin that changes with our development. And it's genetic to a large degree. And so eating a pizza, for instance, won't give you acne because it's greasy pizza. That doesn't happen. So we know that maybe some milk products, maybe high sugar products, maybe have some mild impact on development of acne, certainly, but it's not everything. Then you mentioned stress. So stress is a very interesting phenomenon in our body, and it can worsen a lot of things. If you're under chronic stress, you have changes in your stress hormones in your body that can make your acne worse. Absolutely.
Okay. Yeah.
And we see that one of the drugs we give, called prednisone, which can mimic a little bit like the stress hormones that we have inside our body, can cause and worsen acne. So we can actually give pills sometimes to people that makes them have acne.
What about so sleep, is that similar to sleep?
Yeah,
like
lack of sleep is definitely a very stressful thing, right? If
Yeah.
you're not sleeping, you're going to be under a lot of stress.
Yeah. Wow, that's interesting. Because I think that's a lot of people, or just stress in general, lack of sleep. That must be pretty common.
Yep.
Yeah.
And stress not just impacts acne, like a lot of skin conditions can be worsened with stress.
Yeah, I bet. Well, I'd like to do some myth busting. I'm sure you
Okay, all right.
you might be sick of hearing some of these, or maybe you might be sick of seeing patients who believe some of these. But
I would
maybe some of these
never.
are real.
I view it as an opportunity for education.
Okay,
there you go. I think that's
a positive
that's a
way.
better. Yeah,
That's
exactly.
a good way to think of it. Does drinking water actually help clear your skin?
No, but drinking water is good for you, and you probably should do it.
Should do it anyway.
Yes.
Fair enough.
So
Some
drinking water is
explanation.
healthy for you. Obviously, if you're not drinking any water,
Yeah.
that's not a good thing for your body. Your body's going to go into a stress response. There you go. Potentially, your acne might get worse. So that's what I'm saying. There's always a little bit of truth to these myths.
Right.
That, I need to drink this much water. Otherwise, my acne is not going to get better. Sure, if you dehydrate yourself, your body's not going to like you. You're going to be stressed out. Your metabolism is not going to be happy. Could that worsen your acne? Absolutely, right?
Yeah.
But I wouldn't sit there and you say I need to drink this much water or else.
Right.
Yeah.
I often see people online, or even in person, having these eye patches that they put on their under eye bags, or there's certain eye cream or serum to diminish the purpleness, I guess.
Yes,
under
I have
under
those.
eyebags.
You're probably seeing that right now.
No.
Yeah, it's genetic largely.
Oh yeah.
Yeah. So as you usually inherit it from your parents. So
Once
if you look,
again,
once
their
again, blame
parents.
your parents.
Yeah.
That's the way to go. Obviously, there's some physiological component too. As we age, we do lose the fat pads underneath our eyes,
Okay.
and so the vessels, which is what the purple color comes from, do become a bit more prominent over time.
Okay.
And that's what people see. The same thing is if you have congestion in your nose, they call it allergic shiners, then you can get congestion in the blood vessels and they can become a bit larger and then it looks more purple.
Okay.
So there's medical conditions for it, and there's also genetic components for it, and then there's aging components for it as well.
Okay. So is there a way to prevent? Are those eye patches actually doing anything, or that
I mean,
the eye
they're-
cream actually doing anything?
They're probably moisturizing.
Okay.
We talked about how moisture is
Yeah.
important, and moisture does plump up the skin.
Mm-hmm.
And so if a thin skin makes it more visible, then a slightly thicker skin will make it less visible.
Okay.
So it makes sense.
So there's some
Truth
there
to
could be
it,
some
sure,
help.
yeah.
Okay. Are pore strips, are they helpful? Are they bad for you?
It depends what you're trying to accomplish, I guess. If you don't like the look of blackheads and you want them temporarily removed for a short period of time, then yes, that's what they're good at.
Okay.
But if you think that they're going to result in long-term a scenario where you're not going to have blackheads anymore, or you're not going to have acne anymore, then no.
Would you say is sunscreen the best anti-aging product? Yeah.
Yes, there you go.
That's-
Sunscreen is the best anti-aging product that you can use by far.
Okay.
If you had to invest a certain amount of money in anti-aging therapies, sunscreen is number 1, 2, and 3.
And you should and apply it everywhere too. I feel like people forget like their hands even,
Yes.
right? Like top of their hands,
Yeah.
top of their feet. It's
Yeah.
not just your face that ages, right? It's
Correct.
everywhere.
Anywhere that's going to be exposed to the light or the sun
Yeah.
can age, absolutely. So if you're looking to prevent aging of your hands, a lot
Yeah.
of people don't like the way their hands look when they get older, but
Yes.
sunscreen on top of your hands is very important.
So I hear that the skin is the largest organ.
Mm-hmm.
What does that actually mean, and why should people care?
Well, I think there's a variety of reasons why you should care about your skin. So one is the skin is a good signpost of your health.
Oh.
We know that if you have internal health problems, they often can manifest through your skin. And conversely, we now have very good data to suggest if you have skin disease, the problems in your skin don't just stay there. They circulate through your body. And so treating skin disease is also very important to prevent potential complications in your heart, for instance. So there's a crosstalk between your skin and your body. So that's one thing. And then as human beings, we are social, visual, and so often we, whether we like it or not, judge other people by their skin, what's happening to their skin, and certainly social stigmas can develop from
Right.
manifestations in the skin.
Yeah.
And so that can have major psychological impact.
Yeah.
And so we know that by clearing people's skin, let's say the skin disease like psoriasis or eczema, we can change sometimes their course of their life. You can go from somebody who doesn't want to go out, doesn't want to socialize, doesn't want
Yeah.
to do sporting activities, to somebody who is very confident and
Right.
socializes, does sporting activities and all those
Yeah.
things. So skin really transcends all of the different components of human health. Yeah, I think all of us are acutely aware of the impact that skin and appearances play
Yeah.
in our confidence and how we interact with the world, right?
What do you think is the biggest lie that the skincare industry tries to tell people?
The biggest lie, I think, that the skincare industry and a lot of other industries try to tell us is something you brought up earlier, is that the more money you spend, the better the product. And this concept that you need to spend lots of money to get the good results or the benefits from some of these products, I think, is a lie that is not just indicative in dermatology and skincare, but throughout industry.
I think that's something probably a lot of people should hear.
Yeah.
I think a lot of people stress over how much money they're spending. If they have 20 products that they're applying, or they think they need to apply 20 different products
Yep.
to their face every day,
Yeah.
spending a lot of money, but
Very complicated as well. Lots
Yeah.
of time,
Yeah.
So
Yeah.
if you're spending lots of time on these things, there is obsession that people
Yeah.
have sometimes, and I bring it back to time is important. Try to enjoy life.
Yeah.
Obviously, if you enjoy putting products on, and that's you get the greatest joy out of doing that, then
Right.
by all means, go
Yeah.
right ahead, right?
Yeah.
But if it's causing you stress and you're concerned and
Mm-hmm.
you're obsessing about these things, then that's probably a bad sign.
Yeah. Aging is natural. We are all aging.
We are every day.
Every day, the second we're born, we start aging.
That's right.
So wrinkles are inevitable, but are there? I guess you said sunscreen is the best way to. Is it for wrinkles as well? That's
Yes.
what.
Yeah. Absolutely.
Okay. Yeah.
Yeah. We talked about that elastic component, right?
Yeah.
And that's sort of what snaps your skin back.
Mm-hmm.
So it's really when you lose that elastic component that your skin really starts to wrinkle. And there's also damage to the collagen, which is a substructure of the skin.
Mm-hmm.
That's another thing that can cause wrinkles to become more permanent and visible on a
Okay.
regular basis.
Yeah. Well, I'm just about to wrap up. I just have one last question.
Oh,
I
well.
would just like to know, what would you like all your patients to know, anyone listening to know about skincare and taking care of themselves?
Well, there's a few things that I think are important. So first, I think dermatology is important for health. It's something that should not be ignored and something that we need to enshrine in our healthcare system in Canada. So we definitely need more dermatologists, more dermatology care. So that's the most important thing. And then if you have a dermatology problem, seek help. Don't suffer alone. Don't suffer in silence. There's a lot of conditions. One we haven't talked about, it's called hidradenitis suppurativa, which is one of the most impactful diseases that we see. And a lot of patients, based on the data we have seen, will suffer for 5 or 7 years before seeking medical care from a dermatologist.
Why is that?
There's a variety of reasons.
Yeah.
Again, coming down to that, some people blame themselves for the disease. They say, am I doing something? Some people in the healthcare system will also expand upon that and agree with those types of sentiments. They'll be like, oh, well, so to give you some idea of what hidradenitis suppurativa is, it's a condition where you develop acne-like lesions, but you also can develop abscesses and boils, and then you can get scar tissue, and you can get pus that drains out of these things on a regular basis and affects skin folds.
Okay.
So armpits, under the breast area, groin area preferentially, to the point that the draining, the smell, and the scar tissue can have major impacts on people's lives.
Wow.
And the reason why is because they may go to an emergency room when it's really bad, and they say, here, take some antibiotics for a short period of time, and they're really not getting a long-term treatment. So that's the most important thing for any dermatologic condition is don't suffer alone. There's help out there. Please go seek out a dermatologist.
Absolutely. Thank you for chatting today. I personally learned a lot. I'm sure other people did. This was a very interesting topic, so thank you again. This is Dr. Mark Kirchhof, and thanks for coming on. This is awesome. Thanks.
Well, thank you. It's a pleasure.
Yeah.
Thanks.
Bye, everyone.